button was. So I had to open the line. I could have. Okay, whenever you're ready.
I'm ready.
Okay, let's go.
The broadcast is now starting. All attendees are in listen-only mode.
Good morning. Good morning to a windy province. It's Tuesday, November 25th, and you're joining us for the Quality Improvement Planning webinar from HQO. I'm Julie Nichols, and I'm going to be your presenter today. I also have Terry Donovan in the room. Mark Millward is not joining us, but we also have Linda Valente online, and we're all here to produce hopefully an informative and helpful webinar for you. The webinar will be recorded, and it will be posted for future reference. Here we go. So just a quick overview. I'm sure you've used software similar to this before. If you want to get rid of that little screen over on your right-hand side, you can click on that arrow that's highlighted by the red box, and it will move it off to the side. We do recommend that you use a telephone to call in, especially on these windy days where our internet connections seem to come and go. So if you do need to take a break and just call in, when you click on the use telephone, it does bring up some phone numbers, not those ones. You can use the ones that are over in the dial box. When you have questions, there's an area you can type in questions or chat. So feel free to send us any comments, questions, concerns. We'll be monitoring that through the whole presentation. And at certain points in the presentation, we'll also stop and kind of check on the question box and make sure that we've addressed some of your questions. Okay, so here we go. We have a couple objectives for today. The first one is so that you really understand that the QIP is a tool for driving organizational quality. Another objective we have is that we really want to emphasize the three components of the quality improvement plan: the progress report, the work plan, and the narrative. And we're going to walk you through, using our new software, Navigator, to show you how to prepare and complete these documents within Navigator. And finally, I want to show you some of our resources and support that we have available for you. Here's our agenda. So we're going to talk about quality improvement planning, look at a couple changes for this year for CCACs, and then we'll walk through the different components of the quality improvement plan. And finally, at the very end, we'll walk through a Navigator demonstration, and hopefully that'll be a really interactive section to this where we can go through questions that you have. I think we have a fairly small group today. I'm just going to have a double check. Oh, it's lovely. So we can have, you can feel free to ask questions and not be shy. There's just a really small group attending today. Is everybody able to hear okay? Is everything coming through okay? If you don't mind, just maybe make a comment in the chat or the comment or the questions box just to let us know it's all coming through. Anyone? Oh, good. Thank you. That's great. Okay, quality improvement plans. I actually recognize most of your names on the line, so I think you've been part of the process before for CCAC. So you understand that the QIPS is really here a formal document and a formal commitment from yourself, your organization, to the public, to your patients, to the community. And it's really, and the intent is that across the province we're really sharing our QI efforts and actions. As you know, the province really works with the CCAC sector last year to develop priority indicators, and those are the ones that were included last year, and they will be continued to be the 6 priority indicators for this year. Just wanted to give you a little highlight about HQO. The QIP reporting and QIP analysis is just part of what the quality improvement portfolio does here at Health Quality Ontario. And really our intent is that when we analyze your QIPs, we are able to share with your peers, with the rest of the system, some of the great ideas and things that you're trying to be able to connect each other and build capacity across the whole entire system. So things that you're doing might be of interest to primary care. Some of the things that primary care might be doing might be interesting to you. So that's part of our role here at HQ. Oh, they're there. This is year 2. Really, the first year is just about getting started. And clearly, CCACs got started. Everyone submitted a QIP. Everyone put stake in the ground and really tried to understand the purpose of QIPs, develop measures, develop change ideas, and process measures around those change ideas. And it's a phased approach. So what we've seen throughout the 4 years since EXA began was that, the hospitals, they began just like you, putting a stake in the ground, trying, and then to year 2, found, okay, we can tweak this to fit our needs a little better. We can tweak this to fit the provincial priorities a little better. And then again, in year 3, you start to understand more of your benchmarks and your targets, and you really evolve that QIP. So the QIP isn't meant to be perfect. It's meant to be a growing opportunity, and it's something that we here at HQ really believe is an opportunity for learning. Here's just a little snapshot about, in the province, who's using QIPs. So hospitals, all of the hospitals, all the CCACs, the interprofessional team-based primary care, all of them basically. And for long-term care, it was a voluntary submission process. And so they had close to 20% of the long-term care homes voluntarily submit. So that was a great first start. Just have time to check in here. Are there any questions or concerns coming up, Terry?
No, we're good so far.
Okay. All right, well, let's jump in here. We've talked about our quality improvement planning, and now we're going to jump in a little bit into what's happening for this year. But to get us started, we kind of want to know, in our small audience, how familiar are you with this? Now, Terry, I'll get you to launch that poll. Thank you. So what we're wanting to know is, so you just click on one of them. Yep, I know QIPs. I know it very well. I led it last year, or somewhat familiar. Yep, I've heard of them. I've done it. I've been part of the team, but I don't know the intricacies. Or QIP, what? Like my kids say. What? We'll just give it a second to wait for some responses.
Oh, okay. Everyone has voted.
Oh, yeah.
And, look at this group. Love it. Sorry, was that scary when I went, oh?
Oh, that's good. Okay, so we can skip a little bit ahead through some of the basics and really drill down for you. Okay, this might be new. This is good. What's new for this year? So you did that. You did your submission last year via Excel. This year we're asking and requiring that you use the Navigator tool. I know many of you were on the field testing earlier in the fall, and that gave us some really great feedback for the tool. The tool is almost ready to be launched, and we're going to, again, walk you through your QIP using Navigator today. What else is new? There's a patient engagement section in the narrative where we're looking to find out how do you engage your patients or clients. Progress report. This is actually a really fundamental part of the QIP, where we learn about the successes as well as the failures that have happened over the last year in terms of your change ideas. We want to know about both. We want to know what ideas really worked well and are moving your indicator, and then what things didn't work well and why didn't they work well. And the purpose of that is so that we understand which initiatives may be questionable in terms of spreading that change across the province. And finally, there's a couple updated reporting periods, and the details will be in the guidance document that's going to be released shortly. But there's updated reporting periods for the 2 5-day wait indicators, as well as for the falls indicator. And we have worked with the OACCAC as well as some of your colleagues to look at the availability of that data to update those reporting periods so that they're reasonable. So just rest assured they are a reasonable reporting period. Okay, here we go. Here's Navigator. You can see at the top that's our main login, where you go to log in. And when you go to that page, this is what you see. So there's a Home tab, a Resources tab, Sectors tab. Down on the side, you'll see more information about quality improvement plans, about HQO, and some of our roles. And there's the login section for Navigator. Again, there's the main. So if you need to, after, you'll be able to get this web page from our presentation. So when you click on the Resources tab, that you can click on and access without having to log in to Navigator. It has the Ministry of Health guidance materials, which are expected to be released later this week or next. It has some CCAC-specific FAQs, lots of good stuff on that Resources page. And just generally, when you're looking for some support doing your quality improvement plan, there is always the HQO Quality Improvement Plan website. Again, that resources page. There's the Quality Compass on the HQO website, and I'll show you that a little later. And as always, you can reach us through the QIP inbox. Someone's always manning that inbox. And maybe not so much on the weekend, but actually towards submission time, we do tend to watch it on the weekends as well. Things get kind of busy. Okay, your login. How am I going to get into this Navigator? Each organization will be provided a letter later this week giving you a unique username and password. And once you log in, it will require you to change your password. And it is the responsibility of the organization to manage that login and password. So it's something that you will likely want to share within your CCAC so that multiple users can access the product. We do not provide individual logins, rather it's an organizational login. Okay, so the other tab at the top is the sector QIPs, and this is what's really kind of interesting. Before you could go to everybody's individual websites and have a look at their QIPs, but this is actually a one-stop shop where you can go in and pick your sector. I'm not sure how clear that is for you, but pick your sector, pick your year, pick your LIN. You can really look up anybody's public QIP using this tool. So it's a good way to look for change ideas and look at what else is happening in your local area. Okay, here's the meat of it. So when you're looking to find your QIP, and you do have to log in for this section, as well as you do have to log in for the our QIPs, or the sector QIPs when you're trying to look up others' QIPs. So once you've logged in and you're looking at our QIPs, you can see that we've shown an example here. It's from Erie St. Clair CCAC, and you can see that There's last year's QIP, which we've actually taken the time to load into the Navigator so that it is there for you for this coming year. As well, there's a template for filling out for this year's QIP.
Your voice, we just saw a comment, your voice is fading in and out just a bit, so
Okay.
speaker closer to you there.
Okay. Hopefully that's better. Thank you for the comment. Okay. All right, so once you're ready to look at your QIP, you can either choose edit or submit. But when you're wanting to edit when you're wanting to work on your QIP, you want to click on edit. You can see that there's 3 different sections to your QIP: the narrative, the work plan, and the progress report. It will naturally, the system naturally defaults to the narrative. However, we do recommend that you work on the progress report first. So this is where we started our discussion. So it's on the progress report tab, and you can see that, again, we're using Erie St. Clair as just an example, and this is in the test site, so you don't have to worry. Nothing will be done incorrectly to yours, Erie St. Clair. So here's where you can, this is where you start to get into reflecting on all of the work that you've done last year. And really, it's kind of a note, even as of now, to keep track of all the things you're trying and whether they're successful or not. We're especially interested in the comment section in this in the progress report. We really want to learn about some of the great work that is being done. So what you do here is you click on edit. You're going to edit. You have that indicator. You have your previous stated performance, your performance target, and you want to click on edit. And this is what pops up. So it's a little window, and it does have a scroll tab at the top. So this is just the first screenshot of this pop-up window for your progress report. And so you can see it brought forward your current performance as stated on your previous QIP. And now we're hoping, we're working with the OACCAC to try and preload your current performance. But if you were to put in your current performance, the big yellow arrow is where it would go. And there is a note, and actually there's a really wonderful resource for Navigator that's been created so that when you're going through this process, if in fact you do have to put in your current performance, there's some tips about the current performance in that Navigator guide. So this progress report, this is the bottom part of that pop-up box, and it's really your opportunity to shine and share. Again, we want to hear about what you were trying last year, so we've really been very specific to say, here was the idea you said you were going to try. Did you try it? And what did you learn? And so it's not a positive or a negative if you didn't try or you did try. We just want to know what you tried and why. And even if you didn't try it, why didn't you try it? It might be because you realized the change idea would not work at that time for your area. How's my voice? Still soft? I do have a softer voice, so I'll have to... No comments, Terry? No, I think we're good. Okay. So once you've done your progress report, you've put in your comments for each of the indicators. And this is the key thing I've learned, is that you do have to comment on each of the indicators in your progress report. They all are, especially the priority indicators. Then you can click on these boxes over on the right-hand side, and that will export your progress report either with the change ideas or without the change ideas. Now, for posting, it will be automatically exported with the change ideas, so just so you're aware when you're making those comments. And here's an example of that export. You can see I just threw in some letters there just to get it to show you what it looks like when you export it. So it's really showing the change ideas, was it implemented, and what were your lessons learned. And that's something that you might want to use for your senior management or your board in terms of reporting. So again, something to consider when you are doing that progress report. You're probably getting this now. We really value your progress report because what we hope to do for this year is really emphasize in our reports for the coming year what worked well, what didn't, what should we promote across the province. Something for you to consider, we're always looking for feedback about what reports you would like to see from your QIPS across the province. If there's a specific type of report that you'd like to see as a result of submitting, just let us know at our QIP inbox. Okay, I'm going to take us back to our agenda just to ground ourselves here. We've gone through a brief quality improvement planning. We've gone through some of the changes, brief interview to Navigator, discussion about the progress report. Now we're going to move to the narrative. Should I pause for any questions, Terry, or is it all going okay?
It's going good. There's one question about the letters. Who are they going to be sent to? So I know you were working on that list. I don't know if it was the QIPs or it's the EDs or...
It's probably both. I know we did double check the QIPs, and I do recognize many of your names as the contacts that were on that list. It was a list that was provided by the CCAC QIP working group back in the spring. And so it should be your group as well as copy to the CEO.
Great. And the only other question was just a confirmation that the progress report will be due April 1st, and that is correct. It's for the it'll be the 2015-16 QIP is due April 1st, and all three components, the work plan, narrative, and progress report. When you hit that submit button, it submits all three, so all three must be completed.
Thanks, Carrie. Keep the questions coming. That's great. Okay, so we're going to jump to the narrative. I think. There it goes. So here's the screenshot for the narrative section of the QIP. It's actually really simple. It lists all of the headings down on the left-hand side. And then what you do is just click on the plus button, and it brings up a pop-up box where you type in your response to that overview heading. Now, a special comment about these boxes is they're plain font, so you really can't do any bolding or underlining or formatting to the document in the Navigator. We removed that ability just because it was causing a number of glitches. And so what we recommend is that you keep track of it in the narrative, in the Navigator, and then when you export, after you export it, that's where you can do some of your formatting. But again, it has to be in that final form, right, Terry? They have to be almost ready. You can't, sorry, I'm mumbling here. You can't export and do the format changes and then bring it back to Navigator. You have to do it all out external to Navigator.
Correct. So there's no uploading function. So we just caution organizations doing too much formatting in their, first draft, so to speak, and wait until later when they're, maybe sharing it with quality committees or whatnot, because any formatting and time spent on that, you'll have to do it again when you go back in and work on it and export.
Thanks, Terry. So we have a number of, you'll see as you go through the tool, there's all kinds of opportunities for extra help. Some of them, when you put your mouse over a section, a little pop-up hover help, we call it, it will pop up. Sometimes when you put it over the title, sometimes when you put it over a question mark. And this is the kind of thing that pops up, is this hover help. Sometimes, if the hover help's not quite in the right spot, you can't get to where you want to type, and what you can do is click on the question mark again, or click on wherever this hover help is coming from, and then click on the hover help box itself, and then you'll see one of these crosses that will be up towards the top of the hover help box. Then you're able to move that box around and get it out of your way. Again, you probably won't remember this part come February, so there's a great guide available in the Navigator that will walk you through some of the details. So this is, I just thought we'd highlight really briefly, this is a new section for the narrative for this year, and it does talk about how do you engage your patients or your clients. And they wondered if people wanted, if they wanted to chat in the box, how you are engaging your clients or your patients right now, or how you hope to engage your clients or patients. What we could do is list those out, and we'll be sharing anything that's really new from each of the webinars with each other so that you don't have to re-listen to everybody's webinar. We're offering them several times throughout this week, but we'll do a summary document. That's okay. Moving on. We can move on. Okay. Well, let's keep moving here. Within the narrative, often it's nice to add your organizational logo to that document that's exported. So there's some buttons, easy toggle buttons that you can do to upload your logo. And also, again, the same buttons that you can use to export your narrative. And part of doing, putting your logo on it is to really make it yours, really make it feel that it's part of your organization, not just something that you're submitting to HQO. There we go. Reminder, where are we? Here we go, the work plan. So this is another really key component to the QIP. It's really the heart of your plan for next year. And it's been set up specifically, and you probably noticed this last year in the Excel form, but we've made it really clear that we're following the model for improvement where we have the aim, the measure, the change. So we have in red, what are we trying to accomplish? How are we going to know that a change is an improvement? What are we going to do to make those changes? That's the format of this work plan. You'll see the priority indicators. When you look at this, they are all listed in red. And for CPACs, all 6 are priority indicators. They're pre-defined, there's standard measurement, and they're expected actually to be a focus for you as an organization. Now, if you choose to not work on one of the priority indicators or not have it as a focus, what we're asking is that you provide some comments about why you're not choosing that as an indicator. For example, it might not be within your capacity to address one of the indicators with some of the other changes you have going on this year. And that's completely fine. It's just, we're just asking that you mention why and address why. I'll go back here. Part of the other option is, so you have your 6 priority indicators. You also have the option to add a new measure. And I noticed last year many did add a new measure. So adding a new measure is very simple. Again, it's clicking on that box, and we can go into that in a little more detail in the next couple of slides. First, I want to find out if you are planning on adding an additional indicator for this year. There's a quick poll.
got about 44% voted so far, so we'll just give another couple minutes there for people to vote. In the meantime, I just wanted to, we did have a comment about the patient-client engagement. So one organization has put the patient-family-centered care on their strategic plan, and this will require increased involvement of patients and families in the planning, delivery, and evaluation of care and services.
That's good.
Yeah, so that document, your strategic plan, you will be able to use the copy and paste function for some of those key, points and whatnot, and obviously tweak it to the quality improvement plan. But I'm sure there'll be some good information that you can also easily copy and paste right into your narrative. So,
it's a good point, Terry. That's exciting to hear that people are involving patients and clients in your planning. I know it does take a lot of extra work to organize and to help those volunteers, but it's worth it. Okay, so more not adding an additional indicator for this year. Any comments about why you're not adding an additional indicator? If you have a chance to just put that in the chat, that might be helpful. Or even, sorry, I'm just trying to switch screens. There we go. I was going to ask what you were going to add, so I'd love to hear what you were going to add, as well as why you might not be adding an additional indicator. If you have a chance to chat in that feedback, that'd be great. We can share that in a second. Okay, I'll let you chat that in. And I think what I'll do is, we do have a slide here on how to add an additional indicator. It's actually very easy, and it does have, we do have notes on that in the Navigator guidebook. So I think what I'll do is kind of fly by that. It's fairly simple. If you get stuck, there's always the quick inbox, and there's also always a resource tool. Let's talk about adding data to the priority indicators, because that's something we all have to do. So what you'll do, again, you'll actually click, you'll be clicking kind of in the area where you want to put the data, and then a little picture of a crayon. I couldn't get a snippet of it. A little picture of a crayon, and the word add will appear, and that's where you click on it. And then what you'll see is this box. This box will pop up. So what I did was just take a clip of the less urgent ED visits indicator, just as an example, again from Erie. And so you can see all of this grayed out area. It's going to be pre-populated for those priority indicators. We're also hoping that current performance will be grayed out and provided, but again, we'll have to wait till February to see. What we really want to, what you want to think about is what we call the absolute target. That's the target that you want to achieve for this year. And what you really should think about is, what was your performance over last year? Is there any literature out there that will help you set your targets? How is your peers' performance? So you can go back to those sector QIPs and look at some of your peers to see how are they doing. And so consider all of those things. Also, your senior management, your board, your feedback from others about where could you do, where could you get to for this year. You want to set a target that's reasonable, but you also want to set it so it's a little aspirational. It's a little bit inspiring, and it motivates people to work towards it. The relative target across from the absolute target, that's something that will be auto-calculated. And it's meant to kind of help you realize how big of a target the difference between your current performance and your absolute target. So it's going to say, you know, it's going to improve by 100% or it'll improve by 50%. Just something to help you judge how big is that jump between your current performance. And in your target justification, we're really looking to understand why you chose that absolute target. Is it because it's close to your peers? Are you hoping to maintain and therefore you don't have a big jump in target? You hope to maintain because of many other changes that are happening in your area. Change ideas. I think some of the hardest things when you're first starting out with your QIPS, and something we noticed last year kind of across the province, was choosing change ideas is hard. But it can be easier if you're looking at evidence, and really it's about picking things and outlining things that are based on evidence. Sometimes they're based from brainstorming with your peers. Sometimes they're even from patients. They come up with, hey, why don't you try this? Why don't you try that? It's really about the detail that was kind of lacking for last year, and we're really looking forward to hearing more detail about some of the changes that you're doing. Another piece of common feedback that we provide is that we're really looking for a couple change ideas to move each indicator, because one change idea, not all change leads to improvement, and we really hope to see improvement. So hopefully able to try 1 or 2 or 3 or 4 changes to move that indicator. Here's an example where you might want to look to get some of these changes. The Quality Compass is an evidence-based tool that HQO provides. For home care, some of the best evidence is under the Home Care tab, as well as in the Transitions tab. Now, many of the Transitions tabs the evidence is a little more hospital-based, but it's still things that might trigger future thoughts, like med-rec processes. Like having a multidisciplinary care team post-transition. Another good example about where to get change ideas is HQO's evidence department. There's a whole section of HQO that evaluates evidence and puts together summaries of that best evidence. So for example, there's a COPD evidence framework. And I just pulled a quote from there, and it's talking about flexibility, service continuity and flexibility for COPD patients. So that might be something that you consider when you're looking at some of your COPD clients. Okay, so remember, we're still talking about the work plan and change ideas. I thought we could walk through an indicator really quickly. Terry, I'm just noticing there's a couple comments coming in. Are they all okay?
Yes. Yeah, there's just yeah, I'll go through it in the demo.
Okay. All right, Terry said she'll talk about it in our demo. Mm-hmm. So we're talking about the work plan, we're talking about change ideas. So let's use our unplanned ED visits for low acuity concerns. Okay, so sorry, I jumped ahead. So what you want to do is you click on that box. It brings up the next area, and this is where you really start to fill out some of your change ideas. So the change idea up here in gray will automatically fill out. And whoops, I clicked, that's habit. What we want to see is that each change idea has a different change number. So we're hoping that because all of this will be preloaded into your future year's progress report, for clarity, that you just put one change idea per pop-up box. So for example, let's say we know from last year a significant proportion of the people using the ED for low C-test visits are those with COPD. One change idea could be to ensure nursing supports for COPD are provided at a reasonable interval. So that's one change idea. Another change idea could be to work with your local team to trial a weekly COPD open drop-in clinic with the aim of addressing concerns before they require an ED visit. And again, these are just kind of some brainstorm ideas based on reading that HQO evidence document. And that's just the way you come up with change ideas. You look at the evidence and you brainstorm and you talk to others within your organization. So let's say we're going to try that. We're going to try setting up a clinic. Let's again. I have to take that clicker away. So that's what would go up in that planned improvements initiative section. The methods. So what you do is maybe just set up a meeting with a few care providers and work on establishing a clinic. Your process measure. Again, this is just a brainstorm, but it could be the percentage of COPD clients that have a recent admission that came to the clinic and had a minor ailment addressed. So who was recently in hospital, and did they come to our clinic and have it addressed? And maybe your goal is that you want to see maybe 15% of the COPD CCAC clients each month. And so the aim would be, I've got a little more detail here than I think we really need. I think the aim would be just to look at processes and change ideas that can affect that overall indicator. Something to keep in mind when you're developing process measures are tricky because you really want, but when they work, they're really neat. So what you really want is that you have your change idea. How will you know that change idea is working? And so you want to have measures that are specific and measurable and actionable and realistic and time sensitive, that SMART acronym. And then you also want to make sure that when you're doing that process measure, that it has comments about why you think that process measure will measure that change idea. We're moving along here. Here's our last poll. So I just went over it. I'm just checking to see if you're awake or not this time of the day. Which of the following attribute is not part of a SMART goal? Anyone remember? Specific, monthly, achievable, realistic, time sensitive. And it's not part of a SMART goal.
So 56% have voted. I'll just give it about another 10 seconds here for everyone to vote. Might be able to get. Yeah. How'd we do? Oh, smart bunch here.
Even for early morning, look at that. Okay, so now we're going to jump into more of an interactive session where Carrie's going to switch the questions over to me, and we're going to try walking through a Navigator demo. We need a second just to kind of set up here, right?
Yeah. So, okay. Can everyone hear me okay? So this is, again, this is the pre-production site, and in your letters you will have a link to the real site.
Now are you seeing the, I think I have to switch presenters to you.
Oh, you probably did.
Sorry, technical difficulty there. And is it to the quality improvement plans organizing?
Yes.
See, you guys are more awake than we are.
There we go.
Thank you.
Okay, so now you should see the Navigator home screen. And again, this is pre-production, so you will have the real address in those letters. And you will be given a username. and password that you will change once you log in for the first time. Oh, using this keyboard. Oh, show it maybe. There we go. Okay. This reminder screen we will use to inform you and communicate any key messages that we have. So right now for the hospital and PC sectors that already have their login access, this pop-up message will, if they were to log in today, would say, you know, the guidance material and the indicator specifications, we're just waiting on them. Please check back soon. You know, we're hoping to have this launched by this week. So any key messages, we will always use this pop-up message to remind you. And to close this reminder message, you just click on the red X up there. So as Julie had gone through, there's information about quality improvement plans and HQO. There are sector-specific resources. So we have resources for the CCAC organization, and there's the sector QIPS. But I'm going to focus on going through and adding an indicator. So you will notice that for 2014-15, although you submitted via Excel, we took those and entered them into the Navigator for you. And we did this in order for you to be able to access and utilize the progress report. So when you log in, you will be able to look at your progress report and have the full experience of that. So your longitudinal or dashboard here has last year's plan already submitted, and it will be view only. So for this year, 2015-16, the status is in progress, and you, to work on the plan, will click on Edit. So here are all of the headings from the narrative. And again, if you go over the hover help, you are able to see the hover help that describes what exactly we're looking for. As Julie had mentioned, if you click on the question mark, then this will stabilize the hover help box. And if you move the cursor to the top and get that four-pronged cross, that will enable you to move the box around. And if the hover help has a scroll, then you can scroll down at that time. So to get the pop-up box to enter information, you can either move the cursor to where you see the plus sign, or you can also click on to the title, and the pop-up box will show up. Again, if you want that hover help, you can click on it, move it to the side, or wherever you would like to move it, and then you can begin typing with the box up. So and whatever you'd like to put in there. So when you save and close, then the information will obviously show up there. This is a collaborative space. You can go in, you know, numerous people can be working on it. You can go back in, you know, throughout the QIP planning season and work on it as you go along.
Sure.
Yes.
I was thinking, Are two people able to be in the same QIP at the same time?
Yes.
Okay.
Yes. So if there are two people working on it at the same time, there's always that save button. Whoever hits save last, that would be the data that would be saved. So hopefully there would be two people working on, say, the same indicator at the same time. But they can certainly, someone could be working on the progress report, someone could be working on the narrative, someone could be working with it within the work plan. So for the work plan, again, all of the priority indicators are in red. And what indicator would you like to add, Julie?
Let's look at the readmission.
Okay. Go down to access.
No.
Oh, sorry. To
the number 3.
Okay.
Let's have a look at that one.
So again, click on anywhere. This add button will come up. If you click on anywhere, the only 3 little boxes to fill in here would be current performance, and target justification. And again, current performance, if you put data in there, come February, it may be overridden with administrative data if applicable, if we're able to get it and to put it in there. So this is all grayed out because it is a predefined indicator. If you are wanting to change anything about this indicator, you're basically modifying it. Therefore, you need to add a new indicator. So you can put in the current performance if you had it, but as I said, it may be overridden in February. But again, I would hope it would be very, similar data. There shouldn't be too many.
Do you want to try, Terry, maybe 20%?
Sure.
20% was one of the responses for this year.
Okay. And if it was a new indicator, for the priority indicators, they're probably not collecting baseline, but if they were to add a new one, collecting baseline was pretty self-explanatory, but there was a question about the suppressed data. So if your data was very small and due to privacy reasons you wanted to suppress it, you can click the suppress button. And that is as per QIHI ministry guidelines. The suppression rules applied to all indicators where the numerator was less than 5 and greater than 0, or the denominator was less than 29. And if any of your data is suppressed that we would pre-populate, an X will show up in your work plan. So,
Terry, we do have another question. When will we know if the data is going to be overridden?
Well, basically, you'll know when we open up again in February. But again, we would hope, and I know that from what our HSP friends tell us, that the data from CCACs and whatnot is pretty stable. So I don't think there should be any surprises, and I wouldn't think that it would impact targets that much. That being said, if there were any changes, again, it will be done in February. You can simply just change, if you need to reevaluate your targets, you can do that. Or even in the target justification area, you can explain, we had expected this as to be our current performance, however, it's been overridden with this new number, and you can just provide that rationale and explanation as well.
So if I just summarize back, so when they open the tool in February, the data will either be there, you'll either be able to get it or not by that point, so they'll know.
Yeah, and we hope to, so our HSP colleagues are going to be requesting the data in the coming weeks, and again, so we're not even 100% sure ourselves what administrative data we will have access to. But as soon as we know more about that too, we will update. We'll update everyone and let them know what we're expecting as well.
I know the OACCC has all of your indicators already on their dashboard site. So again, you'll hopefully be able to set targets using that. And then when you come on to Navigator, hopefully it'll all be there. It's going to be lovely. I can just envision it. I just hope it all comes together. Is there still, oh, here's another question. Is there still agreement to be using the 2013-14 annual data for current performance? It depends on the indicator. The indicator reporting timeframes have changed for 3 out of 6 of the indicators. So you'll see that in the technical specs that are coming out from the ministry later this week. It's also going to be in our FAQ, and then you will see it in the Navigator as well. But yes, 3 out of the 6 have changed. I think that's it for questions.
Okay. I just wanted to bring to everyone's attention that in the absolute target, Hover Help, is where we have tried to provide sort of guidance and help when organizations are looking to set those targets. So if there is any links to evidence-informed resources, we've put them in there. If there's a provincial score, they're there. So the rest of these Hover Helps are pretty much just kind of describing what the field or attribute is. But this absolute target should always have something a little bit more to support. So again, if I click on this and I move it off to the side, I see that the provincial score is 17.9, so maybe I want to try and even do a bit better than that, so I'm going to put 17 down. And when I click over, that shows that the relative target percent change from this number to this number is a 15% difference. And again, my target justification might be to be better than provincial average. One other thing I wanted to show is, again, this information about BestPath with a link to BestPath. So if I click on this, it'll take me right to this site. And again, like it's a new window, so you can go right back to the Navigator there. So we tried to put in hyperlinks, again, one-stop shop and resources right at your fingertips. So, and again, to X that. To get out of that, you just X and save and close. And then the information is right there. So then next we would go on to the change idea.
Okay, so here's a brainstorm. How about, so we want to prevent readmissions within 30 days. So how about if we improve the engagement of patients in medication reconciliation? You could say MedRec, yeah. After hospital discharge. So, you know, once they get home, let's get them really involved in MedRec. One idea, one change method. So here's where you really talk about what is it are you going to do in the method. Tiny writing up there. Mm-hmm. So one idea is you could use a tool called My Health Passport.
There's an example of the spell check underline. And if you right-click, you can, My Health Passport.
Mm-hmm. And you could go on to describe it. You know, when you're actually doing this, you could say what it is. This is actually a tool that was developed by sick kids. It's a wallet-sized tool, and now it's being used for adults. So you're going to try that Health Passport, and then what? So you could either look at the utilization of, so you could say the percentage of patients using the Health Passport. I'm brainstorming too, so you could use that. Another idea is you could look at, you could specifically drill down to which clients are being readmitted, and you don't have to type this here, I'm just kind of brainstorming. which percentage of clients are being readmitted due to medication reconciliation concerns. So there's always a couple of different ways you could look at things. And the goal, so if we use this process measure, let's start with even 50% of patients using the tool, and maybe it's the patients that were readmitted, we don't have to put that. So they're using the tool by December 31st. And do we want to say this year? It would be next year, 2015. There we go. Good. So you can see, this is really a short version of it. The more you can tell us, the better. The more you can tell your peers, the better. Again, the more you can tell your public, the better. I'm just going to take a pause and see if there's any questions. Does anybody have any questions so far?
I'll just show for adding a brand new measure. Again, you'll have a blank slate now, and you will need to build on the entire indicator. And I know in one of our primary care presentations yesterday, Marg was saying if anyone's familiar with the Common Quality Agenda, there's a number of indicators there for cross sectors, and they might help to build an indicator if it's kind of building from scratch, or there are lots of other areas of focus out there. But you'll need to include the objective, the indicator, and then the unit of measure. We have a number of different attributes here. If you don't see it listed, you would leave it as other, and then if other, you would specify down here on the right-hand side. As well for population. So when we know that's not in there is children.
Oh, isn't that funny? That's exactly the example I was going to use, Terry. Just thinking about CCACs, and you might want to add an indicator for some of the services you provide for children. It's kind of lacking in the indicators right now.
Yeah.
So that's good you pointed that out.
And there's a number of data sources listed here, and again, if it's not there, please specify, and HQO will take a look at this and update our drop-downs list as needed each year. And for period, we have calendar year, fiscal year, quarter, and there is a red asterisk here, you do need to specify. So if this is a homegrown or organic indicator, you do need to specify that information. And again, same as before, you put in your current performance or collecting baseline, your target, and target justification. So you can use this, delete this measure for any organic or homegrown indicators. You can also, if you've put any information in any of the any data in any of the fields there, you can clear the fields. So you'll notice that one did not save. If you do go to try and delete one of the priority measures, because you're not going to be focusing on it, if you try and delete this measure, it will not let you because it is a predefined indicator. It is one of the priority indicators from the ministry. So again, if you're not focusing on it, just in the comment section, you would include the rationale as to why you're not focusing on that.
Terry, we do have a question that's come in. If we're carrying over items in our QIP from one year to the next, do we have to re-enter in the new QIP, or is it going to pull from the last year's QIP?
So no, you would need to re-enter it again. So it will pull into the progress report. So and actually I can go to that right now. So for the progress report, all of these indicators will have been on the previous year's QIP, along with the current performance and the target that was stated. So the expectation is that organizations will put in the current performance. However, the current performance is also going to be pre-populated or overridden with that February data. So, because it needs to match. If those values do not match, then it will not submit. So again, if there's any discrepancy with the current performance, then you can either include that information in the comment section here, and or if it's way off, then you can email quip@hqontario.ca. So so let's say our current performance was actually 29, and any comments that you have, we surpassed our target due to, and then whatever you did.
I like that comment. I did that one.
And then this, again, is the change ideas. So, did you implement these change ideas as intended? Yes, and then lessons learned. So, what was your experience? Did the change ideas make an impact? What advice would you give to others? So HQO is really looking at this information to help build capacity and learning across the province. In some cases, you might click no, so we didn't, and then why? So we didn't get a chance to implement this, and we're going to try it again on this year's QIP. So just sort of giving us an idea of what in fact is being done. So there's no accountability or judgment or anything on this. It's simply to learn what is working well out there, and like Julie said, maybe what's not working, so that we can try to improve. And then there's an opportunity to add any new change ideas. So if you submitted your QIP last year, April 1st, and at the May quality meeting, someone came up with an absolutely fabulous idea, this is where you could add, new change idea. Fabulous idea, and then any lessons learned with that. So, and then when you click Save and Close, just the top comments are visible here, and if you export the progress report with the change ideas, I'll just show you quickly what that looks like. Again, as Julie mentioned, this is the one that will be posted on the QIPS page, and that's again to promote learning and to see what was working. So again, the change ideas here are listed, and if they were in fact implemented, and then any comments, or you can export the progress report without change ideas. And again, this may be for posting, on your website or in your office if you're just wanting to give it strictly the. I lost track. Just strictly the numbers there without change ideas. So if you want this type of report, so we've heard that the report with change ideas might be more helpful for internal tracking and reports and quality committees, and the without change ideas might be more suitable for posting in the office or whatnot. So we've given you both of those options. So that is the progress report.
Right.
Yeah.
Oh, I was just going to say, do you have a second just to show us on the resources? Is the some of your newer items there? Okay, not yet.
Not yet. Okay. It's the web team's just putting them up right now, so they're not.
So that's good because they're good resources. So once you're able to get in there, probably in the next couple of weeks.
Yeah, well, we're hoping, yeah, by the end of this week we should get it open and get those letters out, and
okay, that's
yeah.
good.
Yeah,
there's some great resources.
So the only other thing I wanted to mention with the progress report is, again, the focus on looking at those priority indicators. And if it's not something they're actively going to work on, then they may want to consider in the comment section just explaining why they're not, because anything on the QIP is going to be brought forward, and then the expectation is to comment on it. So if you're just maintaining an indicator and put it on the quality improvement plan, it's going to come up on next year's progress report. So I don't think that's probably as important for the CCACs, but I do know.
There were a few that did decide to maintain, and so yes, it would be. Actually, there's a good. I'm just looking at the screen right now. It looks like there's a good example about just there's a couple there that are maintaining those indicators, and so they just would want to say, we have it on our QIP. We chose to maintain.
Mm-hmm. Okay, so that's the progress report. So,
another question. It's a good one. For the progress report, should we be entering our progress throughout the year or wait until Feb each year once the data is updated?
Well, I think you could definitely start working on the progress report. So you could start jotting down some of those key lessons learned. And again, you may have an idea in the coming weeks of what your progress achieved would be. It's completely up to you if you want to actually put in that current performance or progress achieved number only to be overridden, but I would certainly start thinking about the comments and those lessons learned. And, again, recognizing that we're only opening the Navigator, at the end of November. We hope to open it much earlier next year. Now that it's been built for CCAC and long-term care, that's been part of the delay. So we're, not expecting that new build next year. So, again, the progress report's used to look back on your progress the last year. As you know, the quality improvement plan is only a snapshot of the one data point in time. We're looking at ways that we can improve that and possibly make it more of a living document and looking at that.
I think that covers it. I'm just going back because it kind of correlates with that question earlier, and I think I wasn't as clear. The question about overriding the numbers. So that will occur in February, and we will let you know about that. I think I said earlier that we're opening the site in February. No, we're opening it next week.
Yeah,
so
yeah.
But just to correct maybe what I said earlier. So we're opening it next week, and the numbers will be overridden in February, and we will have to let you know if we are going to be pre-populating or not.
Yes, yeah, because we, the HSP is putting in the requests, and we're just not 100% sure which administrative data we will receive. But once we know, we will be communicating that with each of the sectors.
Hopefully that makes a little more sense. Okay, so we're going to keep track of all of these questions, and there's also another session booked for this Thursday for CCACs. You're welcome to join, but it will be the same slide deck. What we'll do is keep track of the questions between the two and put together a summary of some of the questions that we think are important for everybody to know about between the two sessions. Where will we see the slide deck?
So the slide deck will be posted on the resources page. So again, this testing site hasn't been updated with the CCAC sector and long-term care sector. But when you go down to tutorial, so oh, there's the user guide. So that has been placed up there already. So I'll show you this actually in a moment, but the slide deck will be posted right with the tutorial. But this user guide goes through everything from adding new indicators to exporting and uploading the,
I think I would have that bookmarked because
yeah, that's really big font, but adding new indicators and change ideas and how to submit and troubleshooting. Oh, I can show the submission. So anyways, this hopefully will be a good support, if you need it. One thing that I'll show you, so this is sort of our progress of what we've done in the QIP so far. So out of all of those narrative sections of 7, we've completed 1, we've completed 2 of the indicators, and we completed 1 of the 6 indicators in the progress report. And when I say completed, this by no means measures quality, because if you'll remember for the 1 narrative, I think I just put 3 words down in that. So, but it just gives you a quick drive-by of, okay, we've started it or we've got some information in there. But if I go to hit submit right now, this mission incomplete list will come up, and this will list all of the omissions, and it breaks it out into the work plan and in the progress report. So it'll say for indicator 1, your rationale must be included in the comments if you are not including this priority indicator. So obviously there was no data, no target, no current performance for this indicator, so the tool is thinking, okay, we're not focusing on it. So then it's saying, but you must include comments if you're not including this priority indicator. Likewise, for indicator 2, we put some data in there, but we didn't put in a target justification, and we didn't put in any change ideas. So our suggestion is to print this page and then work. So you print this page, you close it by clicking the X, you go back into the QIP, and taking that page, you go back in and you look at the ID numbers here on the side. That's indicator 1, 2, and 3, etc. And just start working on that indicator 2. We were missing the target justification. For indicator 1, we either needed to put in the comments of why we weren't working on it, or we need to fill in the rest of this information. So it's a detailed guide of what is missing in order to successfully submit. So when you do all that and fill in that missing information, then you would go back to the submission, you would click submit, and if this window comes up and it's a accountability sign-off window, and it'll ask you just to put in the the quality chair, the CEO or even senior director of quality. Yes, yeah. So it'll have some names in there of the people, titles of the people that you put in there. You just type in their name, and that is your acknowledgement and accountability that when you export the final plan, you're going to sign it off. Printing in those names is all HQO needs. And when you see that accountability sign-up window, you'll know your submission, you're that much closer, your submission is going to be successful, and you'll be ready to go.
You're ready for the next year's cycle.
Yes.
So that was great, Terry. Thank you. I think that submission process is much better. I guess you have the good fortune of not having to go through that last year where people didn't have that list and they couldn't figure out where the issue was that was holding them up from submitting. So that's a great improvement from last year.
Yeah, so that's one of the, I guess, benefits of coming on in year 3 of Navigator. We've hopefully gotten or reduced the amount of issues and bugs and errors. So much more user-friendly for you guys coming on this year.
We're always PDFing too.
Yes, and as I say, by no means is the tool perfect. We still have an ongoing wish list of improvements to make. So once you guys have had a chance to get in there this year and use it, please feel free to, email the QIP inbox with any feedback. And of course, after the submission in April, there'll be a survey sent out for some feedback on the tool. And over the summer, we always do fixes and enhancements. So you'll have plenty of opportunity to help us improve the tool further.
Just checking here, Terry. It doesn't look like we have any further questions. We'll give people maybe a minute to think about if they have any final questions, and then we'll probably give you back, wow, pretty close to 40 minutes of your day. Now don't rush. If there are any questions? No, everybody wants that second coffee. I know I do. Well, as always, you're always able to email us at QIP. Oh, is there one? No? We're always able to email us at QIP Ontario. You're welcome. I just saw a thank you come in. And there's going to be lots of resources, and really looking forward to seeing all the changes that happen this year and what you're thinking about for next year. And feel free to join in on the other session later this week. I think that's it. No other questions.
Thanks,
right.
everyone. Have a great day.
Enjoy your day.